Today, we will be discussing about the radiology of abdomen and pelvis. In the first part of this session, I will be talking regarding the features in plain X-ray of abdomen. In the second part, I will be talking regarding the special X-rays, that is the contrast X-rays of abdomen that we use in certain scenarios. So, before going into the proper topic, regarding X-rays, mainly in the abdominal X-rays, we will be able to identify 4 or 5 types of major densities. And black density means that will be gas or air, dark gray means that is fat, light gray means that will be soft tissue or fluid, white means bone or calcifications, intense white means any metal or implants or prosthesis that is present in the patient. As a first year student, you should be able to comment on this particular X-ray. So this is a plain X-ray of abdomen and pelvis, antero-posterior view. So as you already know, a proper commenting method should contain mainly 4 points. It is plain or contrast. Second point will be the type of skygram, X-ray, CT, MRI, ultrasound, whatever it is. The third point should be regarding the region concerned. Here it is abdomen and pelvic region. Now the fourth point will be the view. This is antero-posterior view. So a plain radiograph of the abdomen is extremely valuable in excluding the biliary and renal calculi, or in case of any urgent surgery, this will be helpful in diagnosing acute intestinal obstruction, rupture of any hollow viscus in the abdomen, or paralytic ileus. So it is taken after preparing the patient after giving purgatives, and the purpose of purgatives is to eliminate the excessive fecal air or gas shadows from the intestine. Now we are moving on to see the different structures, anatomical structures that are visible in this particular view. So we should be able to see bony structures, the vertebrae, the iliac crest, lower ribs, the sacral foraminae, sacroiliac joints, symphysis pubis and all. Also, we should be able to appreciate some of the soft tissues, even though they are not that much clear, but we should be able to appreciate them. So we will be seeing one by one. First, we will focus on the musculoskeletal structures. So here we have the 12th rib. So we can clearly appreciate the shadows of the ribs over here. This is the last one, so that is the 12th rib. Now the rib that is attached towards the T12 vertebra, 12th thoracic vertebra. So here onwards, this is L1, L2, L3, L4 and L5 vertebrae. So this is the next structure. We can see clearly the vertebrae in this particular view. So if you look the vertebrae carefully, you can identify the transverse process on either side of the vertebrae, and over this area you can see the spinous process of the vertebrae. And what you are seeing here is this roughly quadrangular structure will be the body of the corresponding lumbar vertebrae. In between the vertebrae you have this space. This is a radiological space, and this space is actually occupied by the intervertebral disc, and the outer part of this intervertebral disc is made up of fibrocartilage. That is why it is appearing as dark shadow. Now this structure, the lowermost part of the vertebra will be the sacrum. As you can clearly see, there are sacral foraminae over this area. We cannot differentiate between ventral or dorsal sacral foraminae, but still these are the areas of the sacral foraminae. And on the lowermost part of the sacrum, you will be able to see some part of the coccyx also. On the side of the sacrum, obviously this is the area of the ilium, which is the largest part of the hip bone, and in the ilium this upper part will be the iliac crest. The labeling is done on this particular side, and this junction over here between the sacrum and the ilium is the sacroiliac joint. This is the left sacroiliac joint. Why I am telling left? Because the symbol R is marked over here. This is the right side. So this is the left side. So this is the left sacroiliac joint. Here you can see the anterior border of the ala of sacrum. Then we have the arcuate line. We have the iliopubic eminence, and continuation of the inlet of pelvis will be here. In majority of the abdominal X-rays, anterior-posterior view, we will be able to identify the head of femur also in the lowermost part. The hip joint also will be included in this particular X-ray. Now we can clearly see a shadow on the side of the lumbar vertebrae over here. This is of the left side and this one is on the right side. This shadow is belonging to the psoas major muscle. Now we can start seeing the soft tissues in this particular view. First one will be the liver. As I said in the beginning, soft tissues will be not that much visible in the skygram, but using your anatomical knowledge, we can appreciate the position and certain features of these shadows. So the liver casts a shadow which merges with the right dome of the diaphragm above, and sometimes it presents a well-defined lower border close to the right costal margin. That is very difficult to identify the lower border. If you look carefully and the exposure is good, we may be able to see that. In the middle line, towards the midline, the shadow merges with that of the heart and vertebrae, and the left extremity of the shadow over here will be superimposed on the transparent gas bubble of stomach, and usually that is not recognizable. Now, the next structure will be the kidneys, the right kidney and the left kidney. As we have said in the beginning, this is the L1 vertebrae. So the hilum of the right and left kidney will be lying at the level of L1 vertebrae. So at this level, you should be try to identify the shadows of the right and left kidney. Usually, we will be able to see them by the thick layer of fat surrounding them in the facial layers surrounding the right and left kidneys. From the medial aspect of the right and left kidney, from the hilum, we will have the starting of renal pelvis. Renal pelvis will be continuing as the ureter. Even though that is not visible in this particular plane radiograph, we can trace the ureter across the transverse process, tip of the transverse process of L2, L3, L4 and L5. After that it enters into the pelvis. So along this course, we may be able to trace the ureter to identify any radio-opaque stones or any other structures present in it. The next group of soft tissues will be the spleen and pancreas, but as we can see here, that is not clearly recognizable. By the anatomical knowledge, we may be able to identify the position of spleen over here and the pancreas over here. Now, for completion's sake, in most of the abdominal X-rays, we look for air under the diaphragm. In case of any perforation of a hollow viscus in the abdomen, air will be released into the peritoneal cavity, and due to the property of the air that will be collected, that will be located just beneath the right and left domes of the diaphragm. Sometimes these right and left domes of diaphragm is not that visible in the plain X-ray of abdomen anterior posterior view. So sometimes we, for confirmation, we take the chest X-ray also to identify the domes of the diaphragm and the surrounding structures over there. So that's all regarding the general points regarding the plain X-ray of abdomen. And as an exercise, you can try to identify the structures that we were mentioning till now in this particular diagram. From the next slide onwards, we will be seeing regarding the contrast X-rays that we use for visualizing different structures in the abdomen. First, we will be seeing the contrast X-rays related to the gastrointestinal tract located within the abdomen and pelvis. It is examined with the aid of a contrast medium, and the contrast medium that we usually use in these procedures will be the barium sulfate in water suspension. Depending on the organ to be visualized, we give the patient different amounts of the suspension, barium sulfate in the water suspension. So if you want to visualize the stomach, if you are visualizing the stomach, then that procedure will be the barium meal. If you are visualizing the small intestine, coils of small intestine, then that procedure will be known as barium meal follow through. Barium meal follow through. Now the structure that you are visualizing in this particular diagram over here, this is the stomach. We can clearly see that. So this is the fundus part of the stomach. We can see the fundic air shadow within it. We can see the further cardiac portion of the stomach over here. This is the body of the stomach. This is the pyloric region. Now this is the greater curvature of the stomach, lesser curvature of the stomach. This is known as the incisura angularis. This particular angle formed over here. This constructed region over here forms the region of pyloric sphincter. And along the greater curvature of the stomach, we can see certain notches. These notches will show, actually they denote the peristaltic wave. Now after the pyloric region, pylorus, we can see the first part of duodenum over here, and this appearance radiologically known as, this is the first part of duodenum, and its radiological appearance in this procedure is known as duodenal cap. So all these features should be identified in this particular view. You have to note the position of stomach and the shape of the stomach is subjected to wide variations individually. So this is the summary of the features that we were mentioning till now. And one more point to notice, in barium studies, the patient has to be prepared. So the preparations include the patient should have nothing to eat or drink for 6 hours prior to the barium meal study. And he should not smoke, he should not take medicines or chew gums during this period. Another point to note is no purgatives should be given the night before the examination, as they will tend to cause the misleading motor phenomena. And for the patients who are taking medicines containing elements of high atomic weight such as calcium, magnesium, bismuth, and this medicine should be discontinued at least 3 days prior to the test, because they may adhere to the colon wall in the region of splenic flexure and they cast a confusing shadow during the procedure. So these points, these preparations should be common to all barium studies, and this is the summary of the barium meal where we are visualizing the stomach. After visualizing the stomach, if you are taking consecutive X-rays at desired intervals, we will be able to see the coils of small intestine. So we can clearly see the distal part of the stomach. This is the area of pyloric sphincter, and this is the duodenal cap. So we can see the coils of small intestine in this diagram, and this is a contrast X-ray showing the barium meal follow through. Here we can visualize the jejunal and ileal coils clearly. So we can clearly appreciate some coils located in the central region as well as towards the left over here, and we can clearly appreciate some uniform homogeneous appearing coils are located over the more towards the right side as well as towards the pelvic region over here. So this central coils and towards the left region, these coils will be predominantly belonging to the jejunum, and this region will be belonging to the ileum. So one of the easy method to differentiate them is the appearance of this. You can see the feather-like appearance. This feathery appearance is more pronounced in the coils of jejunum, even though similar appearance is present in the ileum, but that is not that much pronounced. So by that itself and by the position itself, you will be able to differentiate between jejunal and ileal coils. So this will be the barium meal follow through. So this is the summary of barium meal follow through. You can go through that. You can clearly identify these points: the absence of circular mucosal folds in the duodenal cap, and this feathery appearance of the jejunum will be due to the well marked plica circularis within it. In this diagram, you can clearly see you are visualizing parts of the large intestine. So this is known as a contrast X-ray showing the barium enema. The large intestine can be examined better by the barium enema itself. Now, we have to prepare the patient for the barium enema specifically. So a suitable purgative should be given 48 hours before the examination to remove the fecal masses. Then a colonic wash should be given prior to the examination also. After that, we can prepare the patient. After that, this colon will be easily outlined by slowly running in 2 to 3 pints of simple barium sulfate suspension through the anal canal. Then we take consecutive X-rays. Then we will identify the different parts of the large intestine. Here you can clearly see the cecal region, then the ascending colon, the hepatic flexure, the transverse colon, the splenic flexure, descending colon. Here will be the sigmoid colon, and this region will be the rectum. So this is in summary of the barium enema. You can clearly see the haustrations also in this particular procedure. Haustrations, which are the unique features of the large intestine. We will now move on to see the contrast X-ray that are used to visualize the parts of the urinary tract. In a plain diagram of abdomen, the kidney outlines can be vaguely seen. To outline the calyces, ureter, and urinary bladder, certain compounds containing iodine have to be introduced either intravenously or through a catheter to make the urinary tract radio-opaque. And the X-ray in which the urinary tract is visualized by a radio-opaque medium, it is known as pyelogram. So plain radiographs of the abdomen should be taken first before pyelography, because these will show whether the kidneys are normal in size, shape and position, and whether there are any abnormal opacities in the renal tract which may require localization by pyelography. So if you do the procedure of pyelography by intravenous injection, that is known as intravenous pyelogram, or otherwise known as descending pyelogram. If you do this procedure in a retrograde fashion using a urinary catheter, then that will be known as ascending pyelogram or retrograde pyelogram. So the structures that are visualized over here will be the outline of the kidney, somewhat visualized over here, and on this side you can see the minor calyces. They are joining to form the major calyces. You can see one or two major calyces over here. They are joining to form the dilated renal pelvis, and as the continuation of the renal pelvis, you can see the ureter. As clearly shown in this diagram, the ureters are actually passing along the tip of the transverse process of lumbar vertebrae. So finally, they will reach the urinary bladder that is visible as a radio-opaque shadow within the pelvic cavity. So this is the summary of intravenous or descending descending pyelography. So it's a commonly used dye for intravenous injection will be iodine containing Condre 420. You can see the procedures over here. After injection, we will be taking diagrams consecutively after 5 minutes, 50 minutes and 30 minutes, so that we can visualize different parts of the urinary tract. Some points regarding the ascending pyelography. So that these are indicated only when the IVP does not show excretion of dye in the urine. We have to pass the catheter or cystoscope into the urinary bladder, and catheter will be placed into the ureters up to the renal pelvis. Contrast medium is injected into the pelvis, renal pelvis, and it does not give any clue about the renal function. So the importance of intravenous pyelogram will be, in addition to identifying the anatomical abnormalities, it also helps to identify the renal function. So in this pyelogram, you can identify the sites of normal ureteric constrictions also. Now we are going to see one of the important contrast X-ray, contrast procedure that we use to visualize the female genital tract. So this procedure, this will be known as hysterosalpingography. So it is particularly useful in cases of sterility and to prove or disprove the patency of the uterine tubes. It also outlines the uterine cavity. It shows the length, shape and position of the fallopian tubes if taken properly. And the most common contrast medium used here will be lipiodol. So how do we do the procedure? We pass a cannula, a suitable cannula, which at the same time obstructs the cervical canal. It is inserted into the cervical canal of the uterus. It will be inserted till the uterus. Approximately 6 ml of the opaque medium is injected and the X-ray film is obtained. So if you are seeing the peritoneal spillage, then that shows the patency of the uterine tubes. So this is a contrast X-ray showing the hysterosalpingogram, and we can see the catheter present in the vaginal cavity over here, and this is the uterus. This is the fundic region. This is the uterine angle. These are the right and left uterine angles. Now if you look carefully, you can trace the fallopian tube over here, and at this particular region we can see the peritoneal spillage. If taken properly, this peritoneal spillage will be visualized on either side, and that indicates the patency of the uterine tubes. So this is the summary of the hysterosalpingography. You can go through the points over here. So in nutshell, when you go through the skygrams of abdomen, you should be able to comment on the skygram, identify and comment properly on the skygrams. And regarding the contrast skygrams, contrast procedures, you should be able to tell outline of the procedure, and you should be able to identify the major structures depicted, major parts of the structures depicted in that particular skygram. Thank you.